200 CNA Test Questions and Answers 2026, Part 1. Question 1. Which of the following is the nursing assistant most likely to observe in a resident who has low blood sugar? Option A, shakiness or trembling. Option B, thirst and dry mouth. Option C, sweet breath odor. Option D, increased urine output. The correct answer is option A, shakiness or trembling. Shakiness, sweating, and confusion are common early signs of hypoglycemia, or low blood sugar. Question 2. Residents are most likely to feel the urge to have a bowel movement at which time? Option A, after taking a nap. Option B, after eating a meal. Option C, just before bedtime. Option D, during the shift change. The correct answer is option B, after eating a meal. Eating stimulates the gastrocolic reflex, which often results in the urge to defecate shortly after a meal. Question 3. Before helping a resident to stand who has been lying in bed, the nursing assistant should do what? Option A, find out what the resident plans to do for the day. Option B, make sure a walker is available for support. Option C, ask if the resident has taken any medication recently. Option D, allow time for the resident to adjust to sitting at the edge of the bed. The correct answer is option D, allow time for the resident to adjust to sitting at the edge of the bed. Dangling the legs at the bedside prevents dizziness caused by orthostatic hypotension when moving from lying to standing. Question 4. While helping a resident get dressed, you notice their breathing is faster and they feel tired. What is your first action? Option A, dress the resident quickly to get it over with. Option B, check the resident's vital signs. Option C, stop the dressing to let the resident rest. Option D, go to find a nurse to check the resident. The correct answer is option C, stop the dressing to let the resident rest. The immediate priority is to stop the exertion and allow the resident to recover their breath before continuing or seeking further help. Question 5. When planning priorities at the start of a shift, what is the most important task for a nursing assistant? Option A, decide break times with other nursing assistants. Option B, review assignments to check if residents are divided evenly. Option C, check all assigned residents to see if anyone has immediate needs. Option D, check what the activity department has scheduled. The correct answer is option C, check all assigned residents to see if anyone has immediate needs. The initial rounds allow the assistant to identify safety concerns or urgent care needs before beginning routine tasks. Question 6. A resident refuses to go for their scheduled walk at 10 a.m. What is the best response? Option A, maybe you can plan to walk a little further this afternoon. Option B, the doctor ordered your exercise and you really need to try. Option C, you have the right to refuse and I will tell the nurse. Option D, would you prefer to walk a little later? The correct answer is option D, would you prefer to walk a little later? Offering a choice in timing respects the resident's right to refuse while still encouraging them to meet their healthcare goals. Question 7. Which of the following is generally experienced by a resident with low blood sugar? Option A, fever. Option B, weakness. Option C, sour breath. Option D, frequent urination. The correct answer is option B, weakness. Low blood sugar deprives the body of energy, leading to symptoms like weakness, dizziness, and trembling. Question 8. An alert resident has requested to be left alone with her husband who is visiting. What should the nursing assistant do? Option A, allow the resident to be alone with her spouse. Option B, suggest that the husband take the resident home for a visit. Option C, explain that facility policies do not allow for this type of visiting. Option D, remind the resident that this is a nursing home and not a hotel. The correct answer is option A, allow the resident to be alone with her spouse. Residents have a legal right to private visits and intimacy with their spouses in a long-term care facility. Question 9. When a resident is dark-skinned, the first signs of skin breakdown may appear in which color? Option A, black. Option B, green. Option C, purple. Option D, white. The correct answer is option C, purple. In darker skin tones, redness may not be visible. Instead, look for purple, blue, or dark brown discolorations. Question 10. Which of the following foods are typically found on a high-protein diet? Option A, pasta and rice. Option B, meat and eggs. Option C, fruits and vegetables. Option D, whole grains and milk products. The correct answer is option B, meat and eggs. Protein is found in high concentrations in animal products like meat, eggs, and dairy, as well as in beans and nuts. Question 11. A resident says she is 5 feet 6 inches tall, but you measure her at 5 feet 4 inches. What should you do? Option A, record the height as 5 feet 4 inches. Option B, record the height as 5 feet 6 inches. Option C, explain that older people shrink with aging. Option D, measure the resident again. The correct answer is option D, measure the resident again. When there is a discrepancy between a report and a measurement, rechecking ensures the data is accurate before it is recorded. Question 12. The use of a physical restraint is intended to do what? Option A, control a resident's behavior. Option B, protect the resident from injury. Option C, make staff members' jobs easier. Option D, decrease how often staff need to check the resident. The correct answer is option B, protect the resident from injury. Restraints are safety devices used as a last resort to prevent a resident from harming themselves or others. Question 13. A resident with a hearing aid keeps asking you to repeat information. What should you do first? Option A, speak loudly and directly into the hearing aid. Option B, check that the hearing aid is in the correct ear. Option C, ask when the hearing aid battery was replaced. Option D, make sure the hearing aid is turned on. The correct answer is option D, make sure the hearing aid is turned on. Troubleshooting equipment begins with the most basic steps, such as checking for power and proper volume settings. Question 14. Where is the appropriate place for a thermometer to be kept for a resident in isolation? Option A, at the nurse's station. Option B, on the isolation cart outside the room. Option C, in the dirty utility room. Option D, in the resident's room. The correct answer is option D, in the resident's room. Keeping dedicated equipment in the isolation room prevents the transfer of pathogens to other areas of the facility. Question 15. What is the best reason for giving frequent perineal care to residents? Option A, it increases comfort. Option B, it decreases sexual responses. Option C, it helps prevent skin breakdown. Option D, it prevents incontinence. The correct answer is option C, it helps prevent skin breakdown. Removing urine and feces is essential because the moisture and acidity of waste can quickly damage the skin. Question 16. The first step a nursing assistant should take when discovering a fire is to do what? Option A, check how quickly the fire is spreading. Option B, remove any residents near the fire. Option C, throw a blanket over the flames. Option D, pull the fire alarm. The correct answer is option B, remove any residents near the fire. The rescue, alarm, confine, extinguish acronym prioritizes the immediate safety of the residents. Question 17. To help prevent burns to residents during meals, the nursing assistant should do what? Option A, place a clothing protector on the resident. Option B, wait to serve the food until hot food is cold. Option C, add ice to any hot liquids like coffee or soup. Option D, let residents know which foods and beverages are hot. The correct answer is option D, let residents know which foods and beverages are hot. Effective communication helps residents handle their own meals safely while being aware of temperature risks. Question 18. A resident tells the nursing assistant about being bored. What should the assistant do? Option A, tell the resident that your days seem long too. Option B, ask the charge nurse if the resident can have some medication. Option C, ask about activities the resident has enjoyed in the past. Option D, tell the resident to check the activity schedule. The correct answer is option C, ask about activities the resident has enjoyed in the past. Engaging the resident in conversation about their interests helps identify personalized ways to improve their quality of life. Question 19. Why is it important to check the feet of a resident with diabetes at least once a day? Option A, to look for sores on the feet the resident may not feel. Option B, to check if vision problems have resulted in foot injuries. Option C, To trim the toenails so they do not become long or jagged. Option D. To make sure the resident does not get a foot fungus. The correct answer is option A. To look for sores on the feet the resident may not feel. Diabetes can cause nerve damage, meaning a resident might not feel an injury that could lead to a serious infection. Question 20. A resident's hands shake when trying to drink liquids. What is the best response? Option A. Thicken the liquid so it will not spill. Option B. Place a clothing protector on the resident. Option C. Seat the resident with others who also spill. Option D. Suggest the resident might do well with a cup with a lid. The correct answer is option D. Suggest the resident might do well with a cup with a lid. Using adaptive equipment like a lidded cup allows the resident to remain independent despite their tremors. Question 21. A confused resident needs more help with dressing today than usual. What should the nursing assistant do? Option A. Tell the resident not to feel bad about needing more help. Option B. Provide extra help as needed to avoid frustration. Option C. Ask if they would prefer to stay in night clothes for the day. Option D. Check if the resident will get dressed for another assistant. The correct answer is option B. Provide extra help as needed to avoid frustration. Care should be adapted to the resident's current functional level to maintain their emotional well-being. Question 22. A resident on bed rest needs a bedpan but cannot lift their hips. What is the best action? Option A. Ask the nurse if the resident should have a catheter. Option B. Turn the resident onto their side to place the bedpan. Option C. Place an underpad or brief to collect the urine. Option D. Have another assistant help lift the resident. The correct answer is option B. Turn the resident onto their side to place the bedpan. Rolling the resident is the safest and most comfortable way to place a bedpan for those with limited mobility. Question 23. A resident grabs his throat and cannot speak during mealtime. What should you do first? Option A. Try to get the resident to take a few sips of water. Option B. Provide abdominal thrusts from behind. Option C. Pat the back and reach in the mouth for the blockage. Option D. Ask the resident to take a deep breath and cough. The correct answer is option B. Provide abdominal thrusts from behind. Inability to speak and grabbing the throat indicate a complete airway obstruction requiring the Heimlich maneuver. Question 24. A resident is in rehab after a stroke and plans to return home. How can you best support them? Option A. Provide total care for the resident. Option B. Set high standards for the resident's achievements. Option C. Help the resident focus on even small accomplishments. Option D. Remind them they will be happier when they are home. The correct answer is option C. Help the resident focus on even small accomplishments. Positive reinforcement of small gains helps maintain the resident's motivation during the difficult recovery process. Question 25. A usually alert resident is having difficulty remembering where he is today. What should you do first? Option A. Increase the resident's fluids since dehydration causes confusion. Option B. Consider that memory loss is a normal part of aging. Option C. Ask where the resident believes he is. Option D. Report the change to the charge nurse. The correct answer is option D. Report the change to the charge nurse. Sudden confusion is not a normal part of aging and could indicate a medical emergency like an infection or stroke. Question 26. A resident has a finished seizure and is breathing. What should the nursing assistant do next? Option A. Get the emergency cart. Option B. Turn the resident onto her side. Option C. Check if the resident is able to talk. Option D. Help the resident back into the chair. The correct answer is option B. Turn the resident onto her side. The recovery position prevents the resident from choking on saliva or vomit after a seizure. Question 27. Which action shows correct handling of a urinary drainage bag for a resident in bed? Option A. Hang the bag higher than the level of the resident's bladder. Option B. Use the measurements on the bag to measure urine output. Option C. Raise the bed to the highest position for drainage. Option D. Wear gloves when emptying the urinary drainage bag. The correct answer is option D. Wear gloves when emptying the urinary drainage bag. Standard precautions require gloves when handling body fluids to prevent the spread of infection. Question 28. A resident wears a hand splint. Which observation should you report to the nurse immediately? Option A. The resident's fingers are cold and blue in color. Option B. The splint was removed as scheduled in the care plan. Option C. The resident asks to have the splint removed for a few minutes. Option D. The resident asks to reposition the arm with the splint. The correct answer is option A. The resident's fingers are cold and blue in color. Discoloration and cold skin indicate that the splint is interfering with blood circulation. Question 29. Which statement is true about the effects of the aging process? Option A. The aging process can be reversed with good healthcare. Option B. Bladder incontinence is a normal part of aging. Option C. Joints tend to be less flexible as a person ages. Option D. Sensitivity to pain increases with age. The correct answer is option C. Joints tend to be less flexible as a person ages. Aging involves physiological changes including stiffer joints and a decrease in skin elasticity. Question 30. A resident is in restraints. What observation should be reported to the nurse immediately? Option A. The resident states that they do not like the device. Option B. The resident's position needs to be adjusted. Option C. The resident has suddenly become very agitated. Option D. The restraint was removed according to the schedule. The correct answer is option C. The resident has suddenly become very agitated. Sudden agitation in a restrained resident can lead to injury, strangulation, or increased physical stress. Question 31. While feeding a resident, you notice they are coughing a lot after each drink. What is the appropriate response? Option A. Allow the resident more time to swallow. Option B. Use a straw when giving the resident fluids. Option C. Add a thickening product to the fluids. Option D. Stop the feeding and ask a nurse to check the resident. The correct answer is option D. Stop the feeding and ask a nurse to check the resident. Persistent coughing is a primary sign of aspiration, which can lead to life-threatening pneumonia. Question 32. A resident has had only 50 milliliters of urine output in the last 6 hours. What should you do first? Option A. Begin offering the resident fluids every 15 minutes. Option B. Report the observation to the charge nurse immediately. Option C. Ask if the resident has pain when urinating. Option D. Check to see if the tubing is kinked or bent. The correct answer is option D. Check to see if the tubing is kinked or bent. Low output in a catheterized resident is often caused by a simple mechanical blockage in the tubing. Question 33. When caring for a comatose resident, the nursing assistant is expected to do what? Option A. Provide mouth care once a day. Option B. Avoid changing the resident's position. Option C. Talk to the resident while providing care. Option D. Keep the resident's room dark and quiet. The correct answer is option C. Talk to the resident while providing care. It is often believed that hearing is the last sense to leave. Talking to the resident provides comfort and dignity. Question 34. When a resident is not able to stand, how is their height usually measured? Option A. Having coworkers hold the resident upright. Option B. Adding the length of legs, chest, and head. Option C. Asking the resident and subtracting an inch for age. Option D. Taking the measurement from head to heels while they are flat in bed. The correct answer is option D. Taking the measurement from head to heels while they are flat in bed. Measuring the resident while they are in a supine position ensures an accurate height for non-ambulatory patients. Question 35. A resident at the dining table begins to have a seizure. What should the assistant do next? Option A. Guide the resident from the chair to the floor. Option B. Remove the other residents away from the table. Option C. Try to open the resident's mouth to check for food. Option D. Keep the resident in the chair by holding their waist. The correct answer is option A. Guide the resident from the chair to the floor. Moving the resident to the floor prevents them from falling out of the chair and provides a safe space for the seizure to occur. Question 36. A resident says their food is poisoned and refuses to eat. What is the best response? Option A. Offer to taste all the food first. Option B. Report to the nurse that the resident is acting crazy. Option C. Ask if there is something else the resident would like to eat. Option D. Leave the resident alone because they will eat when hungry. The correct answer is option C. Ask if there is something else the resident would like to eat. Offering an alternative food item helps ensure the resident receives nutrition while respecting their current state of mind. Question 37. Which of the following is an example of the process of disinfection? Option A. Washing a resident's hands after toileting. Option B. Using a wipe to clean around a resident's stoma. Option C. Cleaning a shower chair with a chemical cleanser. Option D. Cleaning a resident's bath basin with soap after use. The correct answer is option C. Cleaning a shower chair with a chemical cleanser. Disinfection involves using specialized chemicals to kill most microorganisms on equipment and surfaces. Question 38. Which of the following is a protected right of nursing home residents? Option A. To select the specific staff that will provide their care. Option B. To have designated smoking areas in the facility. Option C. To make decisions about their care and treatment. Option D. To have activities offered on every single shift. The correct answer is option C. To make decisions about their care and treatment. Autonomy in medical and personal decision-making is a core component of the resident's Bill of Rights. Question 39. After reporting a red area on a resident's hip, the nursing assistant should expect what? Option A. The resident will be placed on short-term bed rest. Option B. The area will be covered with a protective dressing. Option C. The area will need frequent massage with lotion. Option D. The resident should be positioned to avoid pressure on the area. The correct answer is option D. The resident should be positioned to avoid pressure on the area. Keeping weight off a reddened area is the most effective way to prevent a stage 1 pressure injury from worsening. Question 40. It is most important for the nursing assistant to check water temperature before doing what? Option A. Assisting the resident with mouth care. Option B. Soaking the resident's feet for foot care. Option C. Giving the resident a bed bath. Option D. Washing their own hands. The correct answer is option B. Soaking the resident's feet for foot care. Soaking involves prolonged contact with water. Checking the temperature prevents thermal injury to the skin. Question 41. A resident has pain in the arms and jaw and is sweating. What should you do? Option A. Check the arms and jaw for possible injury. Option B. Check the care plan to see if they are on heart precautions. Option C. Ask if they ate something that upset their stomach. Option D. Recognize the seriousness and report immediately. The correct answer is option D. Recognize the seriousness and report immediately. Pain in the jaw and arms, along with sweating, are classic signs of a heart attack. Question 42. You notice a resident is eating very little of their lunch. What is the most important action? Option A. Check if the resident was snacking before the meal. Option B. Ask if the resident would like something else to eat. Option C. Remind the resident that dinner is several hours away. Option D. Check when the resident last had a bowel movement. The correct answer is option B. Ask if the resident would like something else to eat. Identifying and offering preferred alternatives ensures the resident maintains adequate nutritional intake. Question 43. To help prevent confused residents from accidentally leaving the home, the facility may do what? Option A. Block exit doors. Option B. Restrain residents. Option C. Place large stop signs on doors. Option D. Keep confused residents in their rooms. The correct answer is option C. Place large stop signs on doors. Visual cues like stop signs or disguised doors are safe ways to deter elopement without using physical restraints. Question 44. What is most important to observe when a resident wears elastic compression stockings? Option A. The resident's shoe fit. Option B. The resident's pulse rate. Option C. The way the resident walks. Option D. The color of the resident's toes. The correct answer is option D. The color of the resident's toes. Checking toe color allows the assistant to monitor for adequate blood circulation while the stockings are in place. Question 45. When cleaning, which area of the body is it most important to change the spot on the washcloth for each stroke? Option A. Arms and hands. Option B. Abdominal area. Option C. Face and neck. Option D. Perineal area. The correct answer is option D. Perineal area. Changing the washcloth area during perineal care prevents the spread of bacteria from one area to another. Question 46. A resident is slow getting dressed and misses her friends at breakfast. What should you do? Option A, set out clothing that they can dress in more quickly. Option B, dress the resident yourself to make it faster. Option C, ask if there is any help the resident would like in the morning. Option D, remind the resident that friends will be at activities later. The correct answer is option C, ask if there is any help the resident would like in the morning. Assisting the resident based on their preference helps them meet their social goals while maintaining independence. Question 47. A trash can in a resident's room is on fire. What should the nursing assistant do first? Option A, use the resident's pitcher of water to put out the fire. Option B, open the window to get the smoke out of the room. Option C, yell fire along with the room number. Option D, remove the resident from the room. The correct answer is option D, remove the resident from the room. Removing the person from immediate danger is the first and most critical step of any fire response plan. Question 48. A resident with a feeding tube is scheduled for a shower. What is the appropriate response? Option A, disconnect the feeding tube temporarily to give the shower. Option B, protect the pump with a plastic bag. Option C, ask the charge nurse for assistance with the pump. Option D, give the resident a bed bath instead. The correct answer is option C, ask the charge nurse for assistance with the pump. A nursing assistant is not authorized to manipulate feeding pumps, the nurse must manage the equipment. Question 49. What is the normal medical appearance of healthy urine? Option A, clear. Option B, cloudy. Option C, dark yellow. Option D, strong smelling. The correct answer is option A, clear. Healthy urine should be clear and pale yellow. Cloudiness or strong odors can indicate an infection. Question 50. A resident with a history of falls is found on the floor and is crying. What do you do first? Option A, call for help while keeping the resident calm. Option B, check for injuries while asking how they fell. Option C, place a pillow under the head and cover with a blanket. Option D, consider if the resident is trying to get attention. The correct answer is option A, call for help while keeping the resident calm. Emergency protocols require calling for help immediately to ensure a professional assessment is performed. Question 51. A resident's hands shake while drinking, causing spills. What is the best response? Option A, thicken the liquid so it will not spill. Option B, place a clothing protector on the resident. Option C, seat the resident with others who also spill. Option D, suggest that the resident might do well with a cup with a lid. The correct answer is option D, suggest that the resident might do well with a cup with a lid. Adaptive devices like cups with lids support independence while minimizing messes and embarrassment. Question 52. True or false, a nursing assistant should never exercise a joint past the point of pain. Option A, true. Option B, false. The correct answer is option A, true. Passive range of motion should always stop at the first sign of resistance or resident discomfort. Question 53. True or false, handwashing should be performed for at least 20 seconds. Option A, true. Option B, false. The correct answer is option A, true. 20 seconds of scrubbing is necessary to mechanically remove pathogens from the surface of the skin. Question 54. True or false, you should use hot water when cleaning a resident's dentures. Option A, true. Option B, false. The correct answer is option B, false. Hot water can warp the plastic material of dentures. Lukewarm or cool water should always be used. Question 55. True or false, a nursing assistant can legally give a resident their daily medications. Option A, true. Option B, false. The correct answer is option B, false. Medication administration is restricted to licensed nurses or certified medication technicians. Question 56. True or false, incontinence is a normal and expected part of the aging process. Option A, true. Option B, false. The correct answer is option B, false. While more common in the elderly, incontinence is not a normal part of aging and often has treatable causes. Question 57. True or false, you should always knock before entering a resident's room. Option A, true. Option B, false. The correct answer is option A, true. Knocking is a sign of respect for the resident's privacy and their personal living space. Question 58. True or false, a gait belt should be applied over the resident's clothing. Option A, true. Option B, false. The correct answer is option A, true. Applying a gait belt over clothing prevents skin irritation and shearing during transfers. Question 59. True or false, it is acceptable to share a resident's medical status with their best friend. Option A, true. Option B, false. The correct answer is option B, false. Privacy laws forbid sharing medical information with anyone not on the healthcare team without the resident's consent. Question 60. True or false, a resident has the right to refuse a bath. Option A, true. Option B, false. The correct answer is option A, true. The right to refuse care is a fundamental part of the resident's Bill of Rights. Question 61. True or false, when shaving a resident, you should shave in the opposite direction of hair growth. Option A, true. Option B, false. The correct answer is option B, false. Shaving in the direction of hair growth prevents skin irritation, nicks, and ingrown hairs. Question 62. True or false, mouth care for an unconscious resident should be done every 2 hours. Option A, true. Option B, false. The correct answer is option A, true. Frequent care is necessary to prevent infection and keep the oral mucosa from drying out and cracking. Question 63. True or false, a Foley catheter bag should be hung on the bed rail. Option A, true. Option B, false. The correct answer is option B, false. The bag must be hung on the bed frame, as moving side rails can pull on the catheter and cause injury. Question 64. True or false, standard precautions should be used for all residents regardless of their diagnosis. Option A, true. Option B, false. The correct answer is option A, true. Standard precautions assume all body fluids are potentially infectious and protect both staff and residents. Question 65. True or false, a nursing assistant is responsible for providing emotional support to the resident. Option A, true. Option B, false. The correct answer is option A, true. Psychosocial care is a core duty of the nursing assistant to ensure the whole person is cared for. Question 66. True or false, you should use a paper towel to turn off the water faucet after washing your hands. Option A, true. Option B, false. The correct answer is option A, true. Using a dry paper towel prevents your clean hands from picking up germs from the dirty faucet handle. Question 67. True or false, chronic illness refers to a sudden illness from which the person is expected to recover. Option A, true. Option B, false. The correct answer is option B, false. An ongoing, long-term illness with no known cure is defined as a chronic illness. Question 68. True or false, the rectum is the most accurate site for taking a temperature. Option A, true. Option B, false. The correct answer is option A, true. Rectal temperatures are closest to the body's actual core temperature. Question 69. True or false, you should never put anything in the mouth of a person having a seizure. Option A, true. Option B, false. The correct answer is option A, true. Placing items in the mouth can cause broken teeth, choking, or injury to the caregiver. Question 70. True or false, when a resident is in a wheelchair, the drainage bag should be placed on the floor. Option A, true. Option B, false. The correct answer is option B, false. The bag should be attached to the chair frame and kept off the floor to prevent contamination. Question 71. True or false, a nursing assistant may cut the toenails of a diabetic resident. Option A, true. Option B, false. The correct answer is option B, false. Due to high infection risks, nail care for diabetic residents is usually performed by a nurse or podiatrist. Question 72. True or false, a nursing assistant should report if a resident has not had a bowel movement for 3 days. Option A, true. Option B, false. The correct answer is option A, true. Monitoring elimination patterns is critical for preventing complications like fecal impaction. Question 73. True or false, it is acceptable to talk about a resident's behavior in the staff break room. Option A, true. Option B, false. The correct answer is option B, false. Discussing resident details in public or non-clinical areas is a violation of HIPAA privacy laws. Question 74. True or false, the last sense a dying person usually loses is the sense of hearing. Option A, true. Option B, false. The correct answer is option A, true. It is believed that hearing persists even after a person has become unresponsive during the dying process. Question 75. True or false, you should always use a draw sheet to move a resident up in bed. Option A, true. Option B, false. The correct answer is option A, true. A draw sheet helps lift the resident and prevents skin shearing caused by sliding. Question 76. True or false, hypertension is the medical term for low blood pressure. Option A, true. Option B, false. The correct answer is option B, false. Hypertension refers to high blood pressure, hypotension refers to low blood pressure. Question 77. True or false, when dressing a resident with a weak side, you should dress the weak side first. Option A, true. Option B, false. The correct answer is option A, true. Dressing the weak side first makes it easier to position the garment over the limb with limited movement. Question 78. True or false, it is okay to accept a small cash tip from a resident's family. Option A, true. Option B, false. The correct answer is option B, false. Professional ethics and facility policies strictly prohibit the acceptance of tips or gifts. Question 79. True or false, a nursing assistant should always call a resident by their first name. Option A, true. Option B, false. The correct answer is option B, false. Always use the resident's preferred name and title, such as Mr. or Mrs., to show respect. Question 80. True or false, you must always wear a mask when entering a room under droplet precautions. Option A, true. Option B, false. The correct answer is option A, true. Masks prevent the inhalation of large respiratory droplets that carry infectious pathogens. Question 81. True or false, an incident report should be filled out if you find a resident on the floor. Option A, true. Option B, false. The correct answer is option A, true. Any unplanned event that results in potential or actual harm must be documented in an incident report. Question 82. True or false, a resident with a do not resuscitate order should still receive comfort care. Option A, true. Option B, false. The correct answer is option A, true. A do not resuscitate order only applies to CPR, all other medical and comfort care should continue. Question 83. True or false, you should record fluid intake in the unit of ounces. Option A, true. Option B, false. The correct answer is option B, false. Fluid intake should always be documented in milliliters for medical consistency. Question 84. True or false, range of motion exercises help to prevent contractures. Option A, true. Option B, false. The correct answer is option A, true. Regularly moving joints through their full range keeps muscles and tendons from shortening. Question 85. True or false, you should use a padded tongue blade during mouth care for an unconscious resident. Option A, true. Option B, false. The correct answer is option A, true. A tongue blade or mouth swab helps keep the mouth open safely while you clean the oral tissues. Question 86. True or false, perineal care should be performed from back to front? Option A, true. Option B, false. The correct answer is option B, false. Always wash from front to back to avoid dragging bacteria from the rectum into the urinary tract. Question 87. True or false, a nursing assistant should report if a resident's pulse is 120 beats per minute? Option A, true. Option B, false. The correct answer is option A, true. A pulse of 120 is considered tachycardia and should be assessed by a nurse. Question 88. True or false, you should use lukewarm water for a sitz bath? Option A, true. Option B, false. The correct answer is option B, false. A sitz bath typically uses warm to hot water, around 105 degrees, to promote healing. Question 89. True or false, the acronym PASS is used for operating a fire extinguisher? Option A, true. Option B, false. The correct answer is option A, true. PASS stands for pull the pin, aim at the base, squeeze the handle, and sweep from side to side. Question 90. True or false, a nursing assistant can tell a resident's family their medical diagnosis? Option A, true. Option B, false. The correct answer is option B, false. Only the nurse or doctor is authorized to discuss diagnoses and treatment plans with families. Question 91. True or false, a resident who is NPO is allowed to have ice chips? Option A, true. Option B, false. The correct answer is option B, false. Nothing by mouth means no food or fluids are allowed, including ice chips, unless specifically ordered. Question 92. True or false, it is necessary to wear gloves when providing a back massage? Option A, true. Option B, false. The correct answer is option B, false. Gloves are not required for a back massage unless the resident has broken skin or a contagious condition. Question 93. True or false, bed rails are always considered a form of restraint? Option A, true. Option B, false. The correct answer is option B, false. Bed rails are only a restraint if they prevent the resident from voluntarily getting out of bed. Question 94. True or false, you should always use two people when log rolling a resident? Option A, true. Option B, false. The correct answer is option A, true. Two people are required to safely maintain the alignment of the resident's spine during the roll. Question 95. True or false, cyanosis refers to a yellow discoloration of the skin? Option A, true. Option B, false. The correct answer is option B, false. Cyanosis is a blue or gray discoloration caused by a lack of oxygen in the blood. Question 96. True or false, a nursing assistant should empty a resident's catheter bag at the end of every shift? Option A, true. Option B, false. The correct answer is option A, true. Regularly emptying the bag prevents it from becoming too heavy and allows for accurate intake and output tracking. Question 97. True or false, you should always check for a resident's dentures before they eat? Option A, true. Option B, false. The correct answer is option A, true. Properly fitted dentures are necessary for effective chewing and preventing choking. Question 98. True or false, a nursing assistant should never ignore a resident's call light? Option A, true. Option B, false. The correct answer is option A, true. Promptly answering call lights ensures resident safety and meets their immediate needs. Question 99. True or false, semi-Fowler's position is an elevation of 30 to 45 degrees? Option A, true. Option B, false. The correct answer is option A, true. This position is commonly used to help residents breathe more easily and rest comfortably. Question 100. True or false, you should report if a resident's blood pressure is 90/60. Option A, true. Option B, false. The correct answer is option A, true. This is the lower limit of normal blood pressure and may indicate hypotension in some residents. Question 101. True or false, a nursing assistant should follow the facility's chain of command? Option A, true. Option B, false. The correct answer is option A, true. Following the chain of command ensures that information and concerns are handled by the correct supervisor.